Need a confidence boost? Academic Alliance in Dermatology can help. Certified physician assistant Heather Scull is with us now to tell us more about what procedures may be right for you. Heather, great to have you back.
Thanks, Cindy. Nice to see you.
Aesthetic procedures, what are some reasons why people want to get those done?
Well, most of us have, some area of our body that we're worried about or concerned, and most men and women actually want to look good for who they are and what they are.
Mm-hmm. And a lot of people feel young, and they look in the mirror and they go, I look older than I feel.
Well, that's exactly it. The impression that they're giving off is that they're tired or angry or sad, where in fact that's not exactly what's representing what the physical appearance is. Mm-hmm. And so that is a motivation for most of these people to come in and to have an aesthetic procedure to help reduce those, signs of aging or take away that tired look.
Right. Okay, well, let's talk about some non-invasive alternatives to surgery.
Sure.
We have a before and after to take a look at, and I want you to tell us about I think it's the lips we're looking at right now, and that's where a lot of volume goes as we age, right?
Yes, the lips thin, we get the lines around the mouth, what we call vertical lip lines. And so we have certain fillers from the Restylane and Juvederm families that actually help to either plump the lips or improve the fine lines above and around the lips, or even define the lip, just because our lipstick may fade into the upper lip, and of course that's not too pleasant.
And a long time ago it was just collagen and duck lips, and that is not at all what we're talking about now.
No, it's actually more natural for that person's anatomy. So when you're coming in, we're not giving the lip that is the duck lip look.
All right, let's take a look at another before and after, because there are many areas that we have to work on. The crow's feet is one of them. That just means you've had a happy life and you've laughed a lot.
Yes, no, that's good, but we have means by which we can use Dysport or Botox, and these are temporary ways to improve, like crow's feet, the lines around the eyes, for about 3 to 4 months.
And when people hear Botox, they think, oh, my face is going to be frozen and I won't have any expression. That's not the case at all, is it?
No, you can't actually freeze the face, but it gives the chance for the muscle where Botox or Dysport's injected, allows those muscles not to contract, so then we don't get those lines.
So, and there's another example right there of Botox being used, the foreheads, because, I mean, there can be a lot of lines happening in the forehead.
Yeah, so that smooth appearance can be achieved temporarily with Botox or Dysport, yeah.
Okay, well, let's talk about some misconceptions about fillers, first of all. Okay,
sure.
First of all, I mean, we lose volume in our faces, so filler can often plump up the cheeks. How long does that last, and will it change your whole look?
No, actually, that's a common misconception that, oh, someone's going to know I did an injection before. Right. That's not true. It actually helps to maybe take off maybe a few years, or it just more or less gives you that more improved, fresh look. You still look yourself, and you're still recognizable.
Right.
But it takes off maybe a few years, but more or less, it's not a huge drastic change.
Is there anything that you can do that will give people results for longer than 6 months to a year?
Well, most of the fillers last between like 6 months, maybe possibly 2 years, with a product called Sculptra. And that's one that stimulates collagen building and can last 2+ years. But besides facial surgery, these are more, non-invasive and temporary improvements.
And Botox, where can you put it, and where should you put it on the face?
So Botox can be used, FDA approved in the frown lines and the crow's feet.
Okay.
And so there are other areas too, non-FDA approved, that we can use to help some lines and wrinkles on our face.
All right. Well, Heather, thank you very much for coming in today to tell us about all this. Head to tampadermatology.com/specials for more information and give them a call today. We'll be right back with more Daytime, so don't go away.
Thank you.